Hello, everyone. In this lecture today, I'm going to talk to you about hantavirus infection, a complete overview. I'm going to talk about nomenclature and history of hantavirus infection. I'm going to talk about the definition of hantavirus. I'm going to talk about the structure and transmission, symptoms and clinical presentation, disease burden, and finally, treatment and prevention. The hantavirus nomenclature and history. The virus was first found in rodents near the Hantan River, so it was named Hantan virus. This is the first identified species of hantavirus, and later generalized into the group hantavirus. During the Korean War, many United Nations soldiers developed a mysterious illness with high fever, bleeding, kidney disease. The disease was later identified as hemorrhagic fever with renal syndrome. And the causative agent of this disease was isolated by Ho Wang Lee in 1978, who is a Korean scientist. Important hantaviruses include Nombre virus, Hantan virus, Puumala virus, and Andes virus. Hantavirus are a group of enveloped negative sense single-stranded RNA viruses belonging to the family Hantaviridae. Hantaviruses are zoonotic viruses that naturally infect rodents and are occasionally transmitted to humans. Infection in people can result in severe illness and often death, although the disease vary by type of virus and geographical location. In the Americas, the infection has been shown to lead hantavirus cardiopulmonary syndrome, a rapidly progressive condition affecting the lungs and the heart. Whereas in Europe and Asia, hantavirus have been known to cause hemorrhagic fever with renal syndrome, HFRS, which primarily affects the kidney and blood vessels. The shape of hantavirus is spherical, as shown here. The size is approximately 80 to 60 nanometer in diameter. It has an envelope, and this envelope is a lipid bilayer from the host cell membrane. The surface of the virus is covered with the glycoproteins GN and GC. And these GN and GC glycoproteins, they are arranged as tetramers, and these glycoproteins mediate interactions of host cell attachment and membrane fusion. The genome of hantavirus is divided into three segments: S segment, M segment, and L segment. S segment is approximately 1.8 kilobases, which encodes for N protein or nucleocapsid protein, and the function of which encapsulates viral RNA, forms RNA ribonucleoprotein complexes, and protects genome. M segment is around 3.7 kilobases, which encodes for glycoprotein precursor, which later on is formed into glycoprotein N and glycoprotein C. The function of these glycoproteins are viral attachment to the host cell, membrane fusion, and determines host tropism. The L segment is the large segment, which is around 6.5 kilobases, and this encodes protein L protein, which is RNA dependent RNA polymerases that is responsible for RNA transcription, genome replication, and this is an essential component for viral replication. Hantavirus transmission. Hantaviruses are carried by rodents and transmitted to humans mainly through inhalation of contaminated particles or less commonly by the bites of the infected rodents. Hantaviruses, infected rodents, they shed virus in their urine, droppings, and saliva. And these viruses can survive in the environment, and through inhalation of aerosolized virus from the contaminated dust or air, human can get infected. Apart from this, through the direct contact, touching surfaces contaminated with urine, droppings or saliva, and then touching mouth, nose, or eyes can also lead to hantavirus infection in human. And less commonly, but also happens through the bites of the infected rodents. Activities that increase the chances of exposure to hantavirus infection include cleaning enclosed or poorly ventilated surface, farming in a mice infected area, forestry work, and sleeping in rodent infested dwellings. Virus enters through the nose, mouth, and infects endothelial cells. And this infection can cause hemorrhagic fever with Raynaud's syndrome, SFRS, or hantavirus pulmonary syndrome, SPS. Okay, virus causes increased pulmonary leakage, leading to fever, bleeding, kidney failure, or severe lung disease. Hantavirus infection are uncommon globally, but can be severe with varying case fatality rates by region. How common are hantavirus infection? They are relatively uncommon globally. They are largest burden of hantavirus infection is in Asia and Europe, and the second, and then in Americas. In Asia, the case fatality rates are between 1 to 15%, whereas in Europe, also 1 to 15%. But in Americas, actually, the case fatality rates are up to 50%. And in Americas, it has been found this is specifically due to the Andes form of hantavirus. So global hantavirus infection is around 10,000 to 100,000 infections every year, and the largest burden is in Asia and Europe. So, what are the symptoms? The symptoms usually begin between 1 and 8 weeks after the exposure, depending on the type of hantavirus. Common symptoms include fever, headache, muscle aches, gastrointestinal symptoms, abdominal pain, nausea, and vomiting. SCPC, hantavirus cardiopulmonary syndrome, is and so may progress to cough, shortness of breath, accumulation of fluid in lungs, and shock. And SFRS, which is hemorrhagic fever with renal syndrome. Later stages may include low blood pressure, bleeding disorders, and kidney failure. The diagnosis of hantavirus infection might be challenging because the early symptoms are similar to other common respiratory viruses such as influenza, COVID 19, and viral pneumonia, and dengue or sepsis. So, therefore, careful patient history is essential. One must check the possible rodent exposure, occupational and environmental risk, travel history, and contact with known cases in areas where hantaviruses are present. So the diagnosis of hantavirus involves on serological testings and molecular biology methods. In serology, detection of hantavirus specific IgM or rising IgG titers, IgG antibody in the serum. The molecular biology techniques involve reverse transcription polymerase chain reaction during acute phase when viral RNA may be detectable in the blood. So far, there are no approved hantavirus drugs, antiviral drugs, or vaccines. The treatment is only supportive, that includes respiratory support, cardiac monitoring, and kidney management, simply basically managing the complications. The prevention includes control of the rodent, reduce contacts with rodents, which include control of the rodent, seal up entry points, store food safely, a safe cleaning, disinfectant and dampening, and of course, washing hands frequently. So, rodent control actually leads to lower infection risk. With this, I'd like to end my lecture.